And indeed, today is about two things. One is our general health, and secondly, acknowledging the steps forward and the steps we're taking with regards to the coronavirus vaccine. Now, in particular, I'm delighted that we are jointly able to announce $38 million of Australian government funding for diabetes and cardiovascular care. That's an immensely important step forward, and that will involve three elements. Firstly, $10 million for a national diabetes research centre. This will be a competitive program that will be open and peer-reviewed, and that will focus on diabetic kidney disease, limb diseases, which are complications from diabetes, hypo and hyperglycemia and related conditions. $10 million for a national cardiovascular disease research centre, and that will include a focus on coronary artery disease, heart failure and stroke, amongst other conditions. Then we have $18 million for competitive grant programs for different projects. They could be clinical trials, they could be primary research, they could be development of devices. All of these elements will be through competitive programs. So that's what we're doing with regards to health, because through COVID, one of the things that has been very important, together we created telehealth and rolled it out to maintain the day-to-day health of Australians. And we know that that challenge has been a global one, but because of the advent of telehealth in Australia, we have a particularly strong outcome. Now, with regards to COVID-19, I think the important facts today are that there are 6 community cases across Australia, and I'm advised by the National Incident Centre that this compares with over 600,000 cases globally. 6 cases in Australia, over 600,000 cases globally. And in particular, there are 0 lives that have been lost in Australia. There is 1 Australian in ICU with COVID, and 9,765 lives that have been lost agonisingly at the global level. We know that that means that we are in a situation where the world has over 90 million cases, over 1.9 million lives lost, and each of those are growing at an extraordinary rate. And all of this is against a background where we have borders, international, testing, tracing and distancing. In terms of tests, there have been over 60,000 tests in the last 24 hours, which takes us to over 12.1 million tests Australia-wide. That's a national average of 476 per 1,000 Australians, which is an extraordinary result. In Victoria, the highest rate of testing in the country, that's 507 tests, and in Western Australia, the lowest rate of testing in the country, that's 253 tests per 1,000. So in those jurisdictions which have lower numbers, we understand why, but we would nevertheless encourage the authorities there to work on the testing rates. We have in recent weeks tested over 326 aged care facilities with 0 cases amongst staff or residents. So those are extraordinary steps, but we know in a world of 6 cases within the Australian community and 600,000 plus within the global community that we won't be fully safe until the world is safe. And that's part of the global vaccination rollout, but it's also part of the Australian vaccination rollout. And last week with the Prime Minister and the Chief Medical Officer and the Secretary of the Health Department, who is also the head of the medical expert group on vaccines, we announced the national rollout plan. That in particular was focusing on the population groups. One fundamental part is the distribution process, and so we will have hospitals, most especially within the context of the Pfizer vaccine because of the -70 cold chain, but we will also have the very strong community rollout. Australian government vaccination centres, state-based vaccination centres, and we've been working with all of the states and territories on those, and they're doing a tremendous job. Aboriginal community-controlled health organisations, but also general practices. We have a national vaccination network, which last year saw us deliver 17 million vaccinations for flu, approximately. And that vaccination network is built around our general practices with support from our pharmacies. And so our general practices will commence when the AstraZeneca vaccine commences as part of Stage 1B. And next week we'll be inviting all Australian general practices to participate if they wish. That will involve making sure that they're able to participate in the Australian Immunisation Register and record all vaccinations, to undertake the appropriate training, and if they wish, if they see themselves as a vaccinator, to participate in that program. And we'll open that call for general practice vaccinations next week, which is what I'm announcing with Karen today, as well as this focus on diabetes and stroke. So we're doing extraordinarily well. There's more to be done, but when we compare the international with the Australian outcomes, we see that our doctors and our nurses have not only kept us safe, they have delivered an outcome that is in so many ways the envy of just about all of the rest of the world. And we owe, Karen, you and your fellow practitioners a deep debt of gratitude.